It's a growing and disturbing trend. Young adults, teenagers, and even children dying by suicide.
Even as the numbers increase here in Oregon, lawmakers and schools are pledging to take action, with one district prioritizing mental health in the classrooms. As part of our Better Together initiative, our Fox 12's Kendra Kent brings us this special report.
The Oregon Health Authority tracks these suicides, and year after year, more teens and children ages 10 to 24 are taking their lives. Salem-Keizer Public Schools is just one district that suffered the loss of students and is now trying to help stop these preventable tragedies. Science, math, English. In the world of all things school, there's a new subject becoming a cornerstone of public education: mental health.
The fact of the matter is, suicide rates are trending up.
Oregon lawmakers are calling it a crisis. Children and teens are dying by suicide at alarming rates. According to the Oregon Health Authority, preliminary state data shows youth suicide increased by 26% in 2018. The numbers have more than doubled in the last decade, and younger children are increasingly becoming suicidal. State experts say there's no single cause to blame, but they believe increased screen time, online bullying, and social media can contribute to emotional issues.
All of our children are at risk, and so it's really hard to draw trends because the truth is our kids are stressed out. That's the truth.
That's why school districts like Salem-Keizer Public Schools are putting more emphasis on teaching emotional wellness and suicide prevention, and not just in high school. The district told Fox 12 it's surveying and tracking students' well-being and incorporating age-appropriate mental health lessons at every grade level. The district is also expanding employee suicide prevention training. Now even bus drivers, cafeteria workers, and custodians will know the warning signs. The goal: fewer students slipping through the cracks, especially when school counselors are often stretched thin.
Not just in our Salem-Keizer community, but statewide, as you know, we're just short. We're short on the resources to get all the help that we need.
Another tactic: bringing outside help in. Peer support from kids who've been there.
So we were doing our stress and coping lesson today.
Emma Cooper is a college student and volunteer with Youth Lines. That's a branch of the suicide prevention nonprofit Lines for Life. The organization recently visited Walker Middle School, just one of the district's schools touched by tragedy.
I think the main thing that kind of pushes people over the edge is the isolation of all of it and feeling like you can't talk to other people about what's going on.
The Oregon Health Authority wants to see more programs like these in schools across the state, and for the first time, it has the resources to help. Lawmakers recently dedicated $6 million to youth suicide prevention, allowing OHA to form more partnerships, develop curriculum, and offer grants for trainings and other suicide prevention education.
The antidote to suicide thoughts is not fear, it's hope and connection and relationship building.
More open, honest conversations and less shame.
I do think that there is less stigma behind it.
They hope that's a key to help reverse a devastating trend.
There's always hope, and there's always getting through that moment. It's just giving them the tools to do that.
The Oregon Health Authority says girls are more likely to attempt suicide, but boys are more likely to die by suicide. LGBTQ youth are disproportionately affected. The statistics might be scary, but mental health experts say just one trusted adult in a child's life can make all the difference. For a suicide prevention hotline and resources on how you can talk to a child or friend about suicide and how you can get them help, visit our Better Together page at kptv.com. Reporting in studio, Kendra Kent, Fox 12 Oregon.